Thank you and welcome to the Lake Superior Quality Innovation Network Improving Adult Immunization in Michigan. Melissa will now begin.
Good afternoon and welcome to today's webinar presented by the Lake Superior Quality Innovation Network. The Lake Superior QIN is comprised of three organizations, MPRO in Michigan, Medistar in Wisconsin, and Stratus Health in Minnesota, to support the Centers for Medicare and Medicaid Services priorities for healthcare quality improvement in each organization's respective state. Some of the initiatives that the Lake Superior QIN is currently working on include cardiac care, diabetes, adult immunization, meaningful use of electronic health records, care coordination, which includes adverse drug events, quality reporting for hospitals and ambulatory care practices, healthcare-associated infections, and healthcare-acquired conditions in nursing homes. Today's webinar is going to be focusing on our adult immunizations initiative. This initiative was awarded to MPRO in April, and it will continue on until July of 2019. The focus is on improving Medicare beneficiary immunization rates through improved tracking, documentation, and reporting, with a special focus on reducing immunization healthcare disparities. The reducing disparities will be among racial and ethnic minorities, as well as rural Medicare beneficiaries and dual eligible beneficiaries, and also to increase documentation of Medicare beneficiary immunization into the Michigan Care Improvement Registry, otherwise known as MICR. Our work that we're doing does support and align with the National Vaccine Advisory Committee, the Advisory Committee on Immunization Practices, and the Healthy People 2020 National Campaign. Currently in Michigan, our immunization rates for seasonal influenza are around the 55% mark. Our goals will be, are aligned with the Healthy People 2020 goals, and that is to increase rates to 70% across the state. The Michigan rate for pneumococcal vaccine is 68.6%, and this data is currently only looking at the PTSD 23. And our goal is to get to 75% by 2019, and the Healthy People 2020 goal is 90%. And our third immunization that we're going to be looking at is the herpes zoster. Our current rates in Michigan are low at 4.38%. The national rate for that is 20%. And our goal is to reach 30% across the state, and that aligns with the Healthy People 2020 goals. We're hoping to reach about 53,000 Medicare beneficiaries over the course of this project. People that should get involved include ambulatory care provider offices, physician organizations, and home health agencies. If you have worked with MPRO before, in a previous contract, then this will look familiar to you. Again, we'll be providing education and best practices to help improve vaccine assessment, documentation, and actual immunization rates. We're able to help providers with use of their certified electronic health record. We are vendor neutral, so regardless of which EMR you're using, we're able to help you. We can assist you with reporting to MICR. We also offer feedback and coaching, patient engagement strategies, workflow evaluation and redesign, process improvement, and peer-to-peer networking. We also have our learning sessions and educational opportunities. We will be having these learning sessions in a webinar format like today or in person. We also have a newsletter that goes out every other month to providers, and that includes home health agencies as well. And these learning sessions are a way to share best practices. So we're always looking for speakers and, to share what you're doing in your practices and how you're improving quality. If you haven't already signed a participation form to participate in this initiative, it's very simple to join. It's voluntary and free of charge, and the help that we offer is subsidized by CMS, so there's no cost to the practice or the home health agency. So to join, like I said, there's a participation agreement to sign, and we would ask that you would submit data to us on immunization rates for influenza, pneumonia, and shingles, and also active participation in the project for the duration of the initiative, which would include participation in our learning sessions, or perhaps even writing an article for our newsletter, things of that nature. On our team here at MPRO, we have myself, and then we have Holly Stanhart, the Clinical Application Coordinator, Diane McHagg, MSN Quality Improvement Coordinator, and Samantha Strasberg. She is BSN Clinical Application Coordinator. I'm going to pause for questions on just the initiative portion, and then I'll have Terry from Michigan Department of Health and Human Services tell you a little bit about some other things going on in Michigan. So, Ashlyn, did you want to open the line for questions?
Ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. And our first question is going to come from Donna from Greater Oakland. Donna, please go ahead.
When we were talking about the pneumonia rate, I missed the percentage that you said is currently immunized, and what did you use? Did you say 7 or 23? As the vaccine that you are quoting?
No, Donna, the rate was 68.6% in Michigan, and that was looking at data for the PPSV23, the pneumovax. And it's based on claims data.
And there are no further questions at this time.
Okay, anyone decides that they have a question, you can either type it into the chat, or there'll be another opportunity for questions at the end of Terry's presentation. So I'm going to go ahead and introduce her. Joining us today on the call is Terry Adams, DSN. She's an RN with 28 years of public health experience, mainly in the immunizations field. Terry is the section manager for the Division of Immunization, covering vaccine management and education and outreach for Michigan Department of Health and Human Services. Thank you, Terry, for joining us today. And we're just getting your slides ready, and looks like you should be all set.
Thank you, Terry. Can everyone hear me okay?
Yes.
Okay, perfect. I'm excited to present with you today and work as a partner in this initiative. It's nice to know that adult immunizations are on the hot plate, and so I'm just going to present a little bit about Michigan's initiative to implement the adult immunization standards and some adult vaccine communications that we've been working on. So as you can see, there certainly is a disease burden in Michigan when it comes to vaccine-preventable diseases, and it continues to exist. And this slide demonstrates the large number of adults affected by disease, such as flu, pneumococcal, zoster, HPV, and pertussis. And it's clear to see by these immunization rates that the adult population is greatly under-immunized. When we look at adults, what you need to know is that we have to make an important point with you. That if you have a fully vaccinated adolescent, then you have much less work to do to get a fully protected adult. There are, of course, certain occupational risks and lifestyle risks that you need to consider, but for the average healthy adult, there are very few vaccines that are needed if they were fully vaccinated with routinely recommended childhood and adolescent vaccines. So to put my vaccine manager hat on, we vaccinate our adolescents in Michigan to protect them not only through their preteen and teen years, but also through adulthood. When the new standards for adult immunization practice were published in the National Vaccine Advisory Committee in the spring of 2014, Michigan took an active role in communicating these standards to adult providers in Michigan. And just as a refresher, the standards are assess the immunization status of all your patients at every clinical encounter, strongly recommend vaccines a patient needs, administer vaccines or refer your patients to a vaccination provider, and document vaccines received by your patients. The first essential step to do vaccine needs assessment as part of every clinical encounter is the goal to decrease missed opportunities. Offices should implement protocols and policies to ensure vaccines are assessed at each and every visit, and this should be routine. An important part of this step is to ensure patients get reminders about the vaccines they needed. One of the barriers that we often hear from our partners is adults do not establish routine medical visits. So according to the Michigan Behavioral Risk Factor Surveillance System 2013 annual report, medical checkups for adults are a bit interesting. The number of adults who had a routine checkup in the past year was around 70%, and the prevalence of routine checkups did increase with age. So males, 65%, reported significant lower prevalence than females. White, non-Hispanic males reported lower prevalence than black, non-Hispanic adults. And insured and disabled adults were more likely to have a routine checkup than uninsured or non-disabled adults. So as you can see, adults are going to the doctor. It's just not as frequent as we would like, but they are going. Our immunization rates aren't as high as some of the figures here, so this does offer a tremendous opportunity for improvement for the vaccine needs assessment at every clinical encounter with adults. Well, it seems intuitive that routine checks lead to higher vaccination rates. It's good to see that the data does support that. Michigan adults who had a routine checkup within the past year were more likely to have had their cholesterol checked within the past 5 years, a flu vaccine within the past 5 years, and to have had a pneumococcal vaccine when compared to adults that had not had a checkup within the past year. So what does Michigan do to promote proper vaccine needs assessment for all ACIP-recommended vaccines at every visit? Well, one of the ways we support this standard is through our strong focus on healthcare provider education. Our Immunization Nurse Educator, or INE program, offers modules on a variety of topics, as shown on this slide. Nurse educators from both the Michigan Department of Health and Human Services and the local health departments provide free immunization education to provider office staff throughout the state. The education modules are developed and maintained by our 2 state nurse consultants, and registered nurses from local health departments who have met the established qualifications and requirements are approved to teach these immunization educational programs within their local jurisdiction. Again, all services are conducted free of charge to the provider offices. Presentations last approximately 1 to 2 hours and are approved for nursing credit hours and continuing medical education credit. The adult immunization standards are built into every adult module in this program. Another program that's offered through our partnership between Michigan State University Extension and our office is the Physician Peer Ed Project on Immunizations, or PEPI as we call it. This program relies on carefully selected physician trainers to complete each of the lectures noted on this slide. Through a peer-to-peer educational format, these trainers travel across Michigan giving immunization updates to practicing physicians and their staff. Lectures are given during grand rounds, conferences, and medical staff meetings. Similar to the Immunization Nurse Education Program, the PEPI program offers lectures free of charge at a time and location convenient to the healthcare facility and includes continuing medical education credits. From time to time, these modules, both the nurse and the physician programs, have been utilized as webinars and are usually very successful. 2 programs offer these wonderful opportunities to get our foot in the door at provider offices, and so it's awesome that we have these available and we want folks to take advantage of them. Our office distributes a monthly newsletter called Michigan Immunization Timely Tips, or MIT. This newsletter is packed with timely information regarding immunization, including changes to the recommended immunization schedule. This is distributed to over 8,000 individuals, mostly healthcare professionals, on our immunization listserv. Several of the newsletters include information regarding adult standards. We also contribute to other professional medical organizations for articles, including Michigan State Medical Society in their quarterly Michigan Medicine Magazine. Their Medicine Magazine is distributed to over 8,000 members of the Michigan State Medical Society, including physicians practicing in internal medicine, family practice, peds, OB, gynecology, emergency med, and other specialties. It's also distributed to medical students and residents. And during the spring 2014 issue of Michigan Medicine, our office included a feature article on adult standards using the MAD article format that was available by CDC, and we basically Michiganized it to fit Michigan's programs. We have been promoting the importance of strong provider recommendation for many years. There's been a common theme that has been woven into all of our presentations, including presentations at our fall regional conferences. These conferences are held every year and have been supported by our division for the past 21 years. We hold 8 identical one-day conferences in various geographic locations across the state, including our Upper Peninsula, reaching over 1,800 healthcare professionals, including physicians, pharmacists, PAs, nurse practitioners, nurses, medical assistants, and others. In 2013, a one-hour presentation was focused on healthcare provider vaccine hesitancy, with the importance of strong provider recommendation for everyone in the facility, from the staff answering the phones in the front of the office all the way to the physicians. Previous years, we've also focused on patient and parent hesitancy side. This presentation also documented and discussed communication strategies, sample messages for making a strong presentation. And in 2014, we focused on adult immunizations lecture with rolling out the new adult standards. The second essential step to ensure a strong recommendation from the provider healthcare system is to include sharing tailored reasons why vaccination is right for the patient, highlighting positive experiences on vaccination, addressing the patient's concerns and questions, and reminding patients that vaccines protect them and their loved ones against common serious diseases, and explain the potential costs of getting sick. MDHHS, or our office, has a variety of immunization materials targeted to adult patients available to download from our website. These posters were created with the importance of strong healthcare provider recommendation in mind. The premise behind these posters is to keep the message simple. Don't tell patients everything you want them to know in a poster. Appeal to a wide range of adults, various ages, races, backgrounds, etc., with a range of interest and a variety of activities. Encourage patients to talk to their healthcare provider about the vaccines they need to stay healthy. Spark their interest and encourage a conversation between the parent, patient, and their healthcare provider. And there are just a few of the posters that we have available that are shown on this slide, but there are many more available on our website. These are our flu and Tdap posters that were developed to target healthcare professionals, encouraging them to be advocates for vaccination and to be a role model for good immunization behaviors. They can be posted throughout an office setting to let your patients know that individuals in their facility have been vaccinated, so that their parents and patients will know that they are protected. We know that when healthcare providers are invested in immunizations and immunize themselves, they are better advocates for a patient vaccination. Several years back, we created monthly flu posters in an effort to extend the vaccination season. Similar to the adult posters, the goal of the monthly flu posters was to generate dialogue between the patient and the healthcare provider. As you can see, we have posters for a variety of seasons: fall months, trick or treat, Thanksgiving, don't bring the flu, just bring a dish to pass. Winter months, give the gift that won't keep on giving, spread holiday cheer, not the flu. And spring months, catch the spring fever, not the flu. The message is simple and straightforward. Get vaccinated, talk to your healthcare professional, It's not too late to get vaccinated. One thing to note is these posters are also available in Spanish. We also have a suite of materials for pregnant women talking about the importance of getting Tdap and flu vaccines during a pregnancy. They're simple, straightforward, and to the point. Protect your baby before he or she is born. Get vaccinated. The purpose of these posters is not to discuss everything a pregnant woman might want to know about vaccines, but rather to generate awareness about the need to vaccinate and to begin the vaccine conversations between patients and their providers. For pregnant women that want some information about these vaccines, we have fact sheets available, which are shown on the right. These materials were created before the wealth of materials were available from ACOG or CDC. We are excited to use CDC's new Born with Protection campaign and to incorporate some of these lessons learned from focus groups into updating our materials. We know that many immunization disparities exist in the adult population. However, sometimes being healthy can work as a disparity. Think about a healthy 23-year-old like Ashley going to the doctor's office. How hard would she be pressed to receive a flu vaccine before she leaves? Ashley was just 23 years old, working as a nanny when she experienced flu symptoms last December 20th. By the next day, she went to urgent care, who diagnosed her with influenza, but thought it was too late for antivirals to be effective. And after all, she was young and healthy. The illness progressed during the next several days, and she developed pneumonia. She died on December 27th from complications due to influenza. So even healthy persons deserve our strong recommendation to receive an annual flu vaccine. Ashley's story, as well as other stories from Michigan, have been pulled together in this poster and is available at our state website to help make strong provider recommendations and to get all staff in the office engaged in vaccines. The next step in the process to vaccine administration is endorsing the concept of having all ACIP recommended vaccines available at every site who serves adults. However, in reality, specialists are going to consider, from a business angle, carrying only those that most pertain to their area of expertise. For instance, IDs may only carry HPV, flu, or Tdap, and internists generally focus on flu or pneumonia. So we have to work with the system that we have currently and to ensure that vaccines are administered to adult patients. Overall, vaccination rate for pregnant women is not good in Michigan. And so pregnant women who received a flu vaccination, of those, 70% said they were offered the vaccine, 32% said they had no offer, and 9% had no flu recommendation or no offer of vaccine. So as you can see, this slide shows our flu coverage in Michigan. And when you look nationally, Michigan is at 46.2% of persons aged 6 months and older who were vaccinated with one dose of flu vaccine for last year, and the national estimate continues to be higher than Michigan's coverage at Michigan was at 42.9, and the national coverage is at 46.2, so we are below national. And we lag behind the U.S. estimates at every age group as seen above, but for some age groups we are beginning to close the gap. This slide shows a comparison of flu and pneumococcal reporting, and you can see a decrease in flu and in the U.S., but also seeing an increase in pneumo in Michigan and the U.S. So it's important to take a look at our rates and know where we are and try to focus to improve our immunization rates overall. The group that we're the lowest in is the 18 to 49-year-olds, where Michigan ranks 42nd in the nation. One of the things that we want to highlight is our vaccine replacement program. And this is one of the ways we facilitate vaccine administration. The program depends on federal $317, which we currently use to cover uninsured children in provider offices in Michigan. But we also have the program that will cover adults who are uninsured or underinsured, and this is available at FQHCs, tribal health centers, migrant health centers, and our local health departments. There is an eligibility criteria that folks must meet. They have to be at least 19 years of age or older, again, have no insurance coverage, have a need for specific vaccines, and then have risk factors associated with those vaccines. As you can see, we offer Tdap, TD, MMR, Hep A, Hep B, and Zoster, which is just recently added this month to the program. So we're excited about this program and hope to see an increase in that particular area as well. One resource that we have available to assist with vaccine administration are our quick looks for healthcare personnel. We don't expect providers to remember everything about the immunization schedule and the nuances about administration. So the purpose of these quick looks is to provide a one-page summary of key points on immunizer must know before giving a particular vaccine. Topics covered on these one-page handouts include a variety of things listed on the slide, like vaccine types and brands, indications for use, the schedule, minimal intervals, revaccination guidelines, storage and handling, needle length, documentation, and then, of course, your vaccine information statement that must be given to every patient. The fourth step in the standards is vaccine referral, and we want providers to refer patients in the area that offer vaccines if they're not stocked in your clinical site. You need to be prepared to give an informed referral for vaccines not stocked. And in other words, know the partners that you're referring your patients to. So if you're going to, for instance, refer someone to the local health department, know what vaccines they have available for your patients so they're not frustrated when they show up and they don't have what they need. The next slide talks about settings where adults are having vaccines administered, and this is according to our MICR data from last September. And, of course, we quickly realized that there is a neighborhood approach, and that's the only way that we can get this done is a partnership. We looked at our registry data, and that 15% of adult vaccine doses are given in the pharmacy settings, and this number is likely to continue to grow. We know that some of the areas in our state, a majority of flu vaccines are given really by the pharmacies. And this map shows the proportion of flu vaccines reported to MICR during the 2013-14 flu season by pharmacies. The dark orange colors represent lower portions of vaccines given by pharmacies, and the dark purple colors represent higher portions of flu vaccines given by pharmacies. So this notion of an immunization neighborhood really does make sense for adults as they truly see a variety of healthcare professionals, and we need to utilize all the players in order to raise our immunization coverage levels for adults. Luckily, in Michigan, we do have a tremendous working relationship with our Michigan Pharmacists Association, and our laws do not restrict pharmacists from vaccinating for any age or vaccine. In February of 2013, MPA drafted a resolution to support legislation requiring mandatory vaccination, the documentation of all vaccinations by all healthcare providers that administer vaccinations into the MICR or any electronic database adopted by the state of Michigan. We know that many of the adult vaccinations covered or entered into our registry are entered by pharmacy sites. Again, in Michigan, pharmacists have no restrictions for any age or vaccine, but they must have a relationship with a physician to obtain a standing order. They must also have a physician to gain access to record their data into the MICR. So referral options that we have in Michigan are pharmacies, of course. Great opportunity, they have accessible hours. The challenge is they may not be an in-network provider, so that needs to be verified. Specialists, the opportunity there is certain vaccines based on their specialty. The challenge could be they don't carry all vaccines or most vaccines. And then another referral option is the local health department. They are likely to have some vaccines available. They would have to meet the eligibility criteria, but they may not have the mechanism in place to bill insurances or be considered an in-network provider. So again, know where you're referring and make sure they have what's available that's needed for your patients. We also have FQHCs who are partners in our vaccination process, and other neighborhood partners, employer occupational health, university health systems. Our Visiting Nurses Association is strong in Michigan, so there's opportunities for folks to get vaccinated. Of course, so we're on board with the immunization neighborhood concept. The key here is to keep fostering these relationships among various partners in the neighborhood that can collaborate or partner in adult immunization endeavors. Neighbors like hospitals, pharmacies, and even faith-based community groups may not be directly vaccinating, but can be important partners in sharing the strong recommendation. So we want to make sure we work with all of these partners and promote a full adult immunization vaccination rate and no missed opportunities. Michigan pharmacies, just a brief update regarding them. Michigan Medicaid is covering all adult vaccines at pharmacies. A new policy was put in place as of June 2015. And Michigan Blue Care Network and Blue Cross Blue Shield are covering some adult vaccines at pharmacies and considering the pharmacies an in-network provider so they can bill their insurance at those sites. These are two exciting initiatives that we hope will increase adult immunization rates just due to accessibility. So we have done to promote the importance of vaccine referrals and knowing all your neighborhood partners, but we must engage our partners. Here we have Michigan has an advisory committee called MACI, the Michigan Advisory Committee on Immunizations, which advises our office on immunization programs and policies, including school communicable disease rules and adult rules. Presentations have been given at MACI to roll out the new adult standards and promote immunization neighborhood approach. The importance of cross-provider communication about vaccines using the registry has been discussed at nearly every meeting. We have adult representation on MACI. We have adult infection control specialists, women's health, obstetric and neonatal nurses, Mid-America College Health Association, Michigan Pharmacies Association, and American College of Physicians are all members of the committee. We also have an active and engaging group called our Flu Advisory Board, which was formed to respond to the flu shortage during the 2004-05 flu season. Our FAB members have been a tremendous help during the H1N1 vaccination and giving us a scoop on what's happening in the community regarding flu vaccinations. Adult vaccines have also been incorporated into this group, and various adult topics are discussed during every quarterly meeting. This group contains more community vaccinators and pharmacists, so it's a great sounding board for vaccine referral barriers and strategies to adults. We also work extensively with our Alliance for Immunization in Michigan, or we call it AIM, and this coalition is based out of the southeast Michigan area, but has a statewide presence. They produce the AIM Provider Toolkit. It's been in print since 1996, and it's now online at the aimtoolkit.org. As you can see, here's a shot of the AIM website. All the materials that were included in the printed kit, as well as a ton of additional materials, are available at the website. And again, anything you put in print usually gets out of date pretty quickly in the immunization world. So always go to the aimtoolkit.org site to get the latest and greatest and most updated information. Just a little bit about how we're trying to focus on one of the age groups that have the worst flu immunization rates in Michigan is our college-age young adults. During the past year, we engaged partners that hadn't traditionally worked closely with us before, and we partnered up with college health centers. Because of the 2013 and 14 flu season, we had several deaths of college-age students. We wanted to focus on this group. These college-age students have very low flu rates, and so we partnered with Alana's Foundation to kick off the first ever college and university flu vaccination challenge. And we actually challenged universities or colleges to go against each other, and the rivalries worked really well. We had 14 schools enroll last year in the challenge, and they competed against one another for flu challenge trophies, given to the winning school based on small, medium, and large-size student populations. We feel our kickoff year was a great success, and there are more accomplishments to come. We currently have our kickoff now for this coming flu season open, and we already have 11 schools enrolled so far. We are focusing on additional adult vaccinations, not just only flu when these students present for vaccinations. So lastly, the final step in the adult standards is vaccine documentation. And as Melissa said earlier, in Michigan, we have providers who are urged to document all administered and historical vaccines into our Michigan Care Improvement Registry, or also known as MICR. This step also focuses on helping offices, patients, parents, and other providers know which vaccines your patients will have. As a follow-up with parents or patients and providers, you can refer them and pull them up in MICR and know what they are due. Once the patient has been vaccinated, make sure the vaccines are reported so all providers and partners in the neighborhood know what has been administered. We've talked about MICR a little bit throughout this entire presentation, but it clearly plays a role in all the steps of the adult standards. However, now we are focused on documentation. I'd like to give you a little bit of background on our registry. It was implemented in 1998 for healthcare professionals just to track childhood vaccinations. It's continually populated since 1994 with birth records linked to the Michigan Vital Records. Providers who administer vaccines, they're required to report within 72 hours of administration for children less than age 20. And in 2006, we expanded to adults, and we strongly recommend and encourage all providers who vaccinate to report to the registry, including adult vaccinations. We are fortunate to have such a robust immunization registry in Michigan with about 6.1 million adults in MICR, and this exceeds the number of children that we have in the registry. We have 44.9 million individual vaccines recorded for adult patients. 6,000 immunization providers report data to the MICR, and in 2014 we had over 1,400 pharmacies report around 650,000 doses to the registry. So we're excited about the pharmacy partnership, and we're seeing adult numbers grow in the registry, primarily due to the pharmacies. We also have HL7 production live as of June 30th, 2015, so sites are working well to get that data into the registry. One of the things that we have done here, we have an epidemiologist, Christy Bramer, who pulls together quarterly reports that we refer to as our MICR County report cards. These report cards are sent to the local health departments, immunization providers, and are accessible to the public on the web page listed on the screen. These report cards track vaccine coverage across the lifespan and include percentage coverage levels as well as rankings against the 83 counties in Michigan, plus the city of Detroit. At the top of the report card, counties are given information on the number of active MICR and VFC sites included in their jurisdictions. And here is a zoomed-in glance at the report card for the adult section. The measurements include 1 Tdap for adults 19 to 64, 1 Pneumovax for adults 65 and older, 1 Prevnar 13 for adults 65 and older, 1 Zoster for adults 60 and over, and 1 flu for adults 18 years and older. The census denominator is used to determine coverage level percentages, and the percent difference column compares the change in county coverage since the last report card. Coverage levels are compared by county, state, national coverage levels, and as Melissa mentioned earlier, the Healthy People 2020 goals are included for comparison and goal-setting purposes. Counties are ranked among the Michigan's 83 counties plus the city of Detroit, and these report cards have been really well received by our local health officers, medical directors, and has also fostered a sense of competition amongst our counties to improve their immunization coverage levels. Current Michigan adult immunization data is listed here, so you can see where we're ranking as of June 30th, 2015 for Tdap, Pneumovax, Prevnar, and Zoster for the ages indicated. And we just listed all of the previous rankings. So you can see we are increasing in every category, but we still have a long way to go. We do see this increase, and we also kind of think that that's probably due more to pharmacies and providers giving us more adult data, but we always like to see an increase. So promoting the registry to adult providers is something that we're trying to do, and we've created this piece. It's called MICR is for Adults too, and it outlines what MICR can do for your office, benefits for using it for adults, and key facts about MICR and adult vaccines. This will be distributed to adult immunization providers and used by local health departments, MICR, and state staff to help promote the registry to adult providers. So that's the completion of mine. Ashlyn, I think we're ready to open back up for questions. Operator? Ladies and gentlemen, if you have any questions at this time, please press the number 1 key. Again, if you have any questions at this time, please press the number 1 key. And there are no questions in queue at this time.
So I want to thank everyone for joining us today for the Improving Adult Immunizations in Michigan. And thank you, Terry, also for giving us some information on the Michigan Department of Health and Human Services programs that are available for providers in our state. Just want to let everyone know that the slides will be available on our Lake Superior QIN YouTube page in about a week. At this time, we ask that everybody fill out the evaluation questions. They're on the right side of your screen. Please take a moment to let us know how we did by filling this out. And I want to thank everyone again for joining us. And if there are no further questions, we can go ahead and end the call for today. Ashlyn, do you want to check one more time for questions?
Yes, ladies and gentlemen, if you have any questions at this time, please press the number 1 key. And there are no questions in queue at this time.
Okay, I just wanted to add, if there was anything if you had any other questions about the initiative or what MPRO is doing in the state, please feel free to contact us. My email is mottinge@mpro.org, and that will be on the slides once they're posted. And we're happy to meet with you and discuss the program in person, and also look at ways that we can kind of be a wraparound service, or maybe something that you're already doing, just to be an additional resource that you can use. We also are going to be offering benchmark reports to the practices that participate with us, and you'll be able to see your rate compared to the other 200 providers that we're working with throughout the state. Again, I want to thank everyone for joining us. Thank you, Terry, for joining us, and everybody have a nice day.